Excellencies, distinguished guests, thank you very much for joining me today. Risking repeat, the urgency of better pandemic preparedness is the topic we want to talk about today. And the world, as we stand here today, really has two tasks ahead. First, on the one hand side, we really need to end this pandemic because it's not over in many parts of this world, and we need to help people rebuild their livelihoods and make sure they enter into sustainable economic recovery. And secondly, at the same time, we have to learn the lessons from this pandemic, and we need to make sure that it never happens again in the same way it has happened this time. I'm very excited to moderate the session today with my distinguished guests. And I hope we really have the opportunity to dive a little bit deeper into two questions. On the one hand side, we have seen a lot of innovative practices and tools and innovations coming out of this pandemic. And we need to make sure, if I may say so, to leverage this political momentum and make sure how can we capitalize on these lessons learned. And secondly, if we look ahead into the future, into our institutions and governance questions that we've asked ourselves, how can we make sure that we apply these lessons to the time ahead and to better pandemic preparedness in the future? The Paris Peace Forum is taking place at a very important point in time. The G20 just finished and concluded, and it has actually established a task force, a health and finance task force, that is looking at health and finance preparedness. And later this month, we have an extraordinary session of the World Health Assembly that has taken the task to really talk about governance and the potential on a special session what to do and how we need to think about future agreements or institutions that we may want to set up as we are thinking about pandemic preparedness and response going forward. I'm thrilled to introduce our speakers for this session. First, to my right, WHO Director Dr. Tedros. Thank you very much for joining us today. EU Council President Jean-Michel. Thank you very much for joining us today. Remotely, we have the Director of the Wellcome Trust, Jeremy FARRAR. Welcome, Jeremy, to this panel. And I'm very pleased to also have joining us remotely Dr. Christian Happy, the Director of the African Center of Excellence of Genomics of Infectious Diseases. And he'll be able to report of the current work that is very exciting and that's ongoing. So thanks again for joining us today at the Paris Peace Forum, and maybe I'll dive right in with a couple of questions to kick us off in this very important discussion. Dr. Tedros, I've said it at the beginning, we've been in this pandemic now for over 18 months, and unfortunately it is far from over in many parts of the world. We are really seeing an enormous inequity, and this is something that is concerning us, not only with regards to vaccine distribution, but also with regards to economic recovery as we're looking ahead. If you had to take stock where we are today, where do we stand, and what are the broad things that are on your minds as you think ahead that we need to ensure are happening as we're looking into pandemic preparedness going forward?
Yeah, thank you. Thank you very much. First, maybe I will start from protest because the panel is full of men, except our moderator. Probably we will improve that in the future. To start your question, maybe I can rephrase it saying, when will the pandemic end? I think that's the core of the question, because from the situation, that's I think the key question that's coming again and again. The answer to that question is the pandemic will end when the world chooses to end it, because it's in our hands. It's no longer a matter of technology or a matter of science. It's a matter of political will and courage. And that's what we're missing, to be honest. As you know, we have made significant advances with, historic record time of developing vaccines. So there is progress in developing effective vaccines. There is progress in developing medical tools. What's remaining now is the will and courage to act. Then, if you see the situation now, we're getting 5,000 deaths per day, a report of 7,000 deaths on average. 7,000 deaths per day is really huge, and that's around 50,000 per week. And we have already crossed the 250 million number of cases, and we have more than 5 million deaths total. By the way, there is under-reporting, so I think the number of deaths should be higher than that. And lately, especially after a couple of months of decline, now we see an increase in number of cases and deaths. And it means the pandemic is not over. And it means we have to be as aggressive as possible. And the reason behind, still the current precarious situation we see is, as you rightly said, ineffective implementation of the public health measures. People are really sick and tired and not observing the basic public health measures. And it's also the inequitable distribution of vaccines. As you may know, more than 80% of the vaccines already delivered so far, out of the 7 billion doses delivered, more than 80% went to the G20 countries. So 20 countries, more than 80% of the 7 billion doses. Especially Africa is, where as a continent which is really seriously affected by the inequality or inequity of vaccine distribution or vaccine nationalism. And it's an average 5% vaccination coverage as we speak. That's very, very low. And this has to be addressed because, the vaccine inequity is epidemiologically, economically, and morally wrong. And this, inequity has to end if we're going to end this pandemic. And that's why WHO and partners set a goal of 40% by the end of this year and 70% of vaccine coverage by mid next year. Still we expect that, or we estimate that 80 countries may not reach the 40% coverage by the end of this year if the current trend continues. And that means the deteriorating situation we see will not improve. We ask all those governments with high coverage, vaccination coverage, to share doses and also to swap their queue in the delivery of vaccines. As you remember, 1.3 billion doses were promised during G20, but a fraction of it is delivered, so that has to improve. There are some better signals lately, but we need more. There was a meeting yesterday that I attended, organized by Foreign Secretary Blinken and of foreign ministers. They have agreed to follow up on the targets as foreign ministers, and that's very encouraging. And they have also agreed to meet soon, to make sure that the 40% target is achieved. and I hope that will work. But I believe that that kind of push will be important, and achieve the 40% target by the end of this year. No country will vaccinate, with high vaccination coverage will end this pandemic alone. It's only when everyone is safe that each and every individual is safe. And it's in the interest of all countries to make sure that the target, the 40%, is achieved for a common good. And if we're really interested to end this pandemic, and that I started, by saying, the pandemic will end when we choose to end it. It's in our hands. It's because the tools are at hand and we have a set target. And if we can achieve that, we can end this pandemic. So that's what the situation is, and also the means is at hand. The key is now political will and courage to end it. And I hope the world will say enough is enough, because the whole world is really sick and tired of this virus. And I hope this is a time to say enough is enough. And thank you so much for this very important question.
Thank you very much. Thank you. And I think we all agree with you that we are facing an incredible inequity here that we need to address. President Michel, 1 year ago at the Paris Peace Forum, actually, you were suggesting, the introduction of a treaty of some sort in order to improve pandemic preparedness and responsiveness. So the question I would be interested in hearing from you is, why do we need such a treaty? We have lots of international treaties, and how could we make sure that this is a difference? And what are you exactly looking for at the World Health Assembly, the special edition that is coming to us? What would you like to see agreed?
Yes, one of the first reasons is what Dr. Tedros just said. We see that the pandemic that hit the world shook up a certain number of things that we took for granted. But we also saw some encouraging things, such as the capacity of the scientific community to produce vaccines, the increase in production capacity in some areas, not all, Africa being a case in point. And the pandemic showed how important it was to work together to detect signs early and to share data and information for greater transparency. When we need to make a decision, the likelihood of taking the right decision increases when you have access to information. And all political leaders across the world at the beginning of this pandemic were really working with very little information. They were facing the unknown, and they needed information to make the right decisions. So indeed, yes, this has great symbolic value. A year ago, we put forth this proposal, which received a great deal of support, notably from Dr. Tedros. And 1 year later, we are on the verge of a negotiation at the end of the month during the General Assembly of the World Health Organizations. Now, why? Because we need a rules-based international order. And after the Second World War, the world understood that we needed to draw lessons from this, to fight against nationalism or looking inwards, to foster international cooperation. And health, as we see, is a crucial issue that requires international cooperation. And I would like to commend the efforts of Dr. Tedros, who worked for greater equity, because greater multilateralism, greater cooperation leads to more equity. And legally binding information that will encourage the sharing of information will help us cooperate better and look to the future to ensure that in the future we are not faced with the major injustice we're seeing today. The African continent today is very late, and it is a threat for the African continent, but for the world. And so we need these legally binding mechanisms that can guarantee access to vaccines everywhere. Now, I will be brief, but to complement what Dr. Tedros just said, the European Union is very keen to resolve this injustice. That is why we continue to export doses. We were the only ones to do so. We also mobilized 3 billion for COVAX. And now the fact that India will be able to export doses will help us as part of COVAX. And very recently, member states were able to add 200 million additional doses. And so in the weeks to come, it is very likely that we will be able to accelerate our ability to meet needs in Africa and in other developing countries.
This was an important appeal, and I'm turning to Jeremy FARRAR, the director of the Wellcome Trust. And Jeremy, you have been, and as we are talking about the importance of a treaty and what we really need to come back to drastic comparisons like war times in order to think about what such a treaty could achieve. You've been an important player at the G20. You've been advising the high-level panel. You're part of the GPMB, the Global Pandemic Monitoring Board. You are someone who's always called out for accountability and responsibility in any future construct as we're looking ahead and independence. So as you've been part of all of these fora, how optimistic are you that, we are getting this time around, we're getting it right? And what are the recommendations that you're seeing that we really should bear in mind?
Thanks, Anja, and it's a pleasure to join Tedros and President Michel and Professor Happy on the call. And thanks to the Paris Peace Forum for bringing us together. You have to remain optimistic because there has to be hope. But you can only turn that optimism and hope into reality if we match the warm words that we've heard many times over the last effectively 2 years. Going back 20 years, to be honest, and turn those into action. I couldn't agree more with Dr. Tedros' comments there, and the need to focus on the here and now. And it is very important to call for the sharing of information. We all would agree with that, but we have to build in the critical other component of that, which is that with sharing of information comes an absolute commitment to sharing the benefits of the information that flows from that. And if we continue to have the inequity we have at the moment, then it would make it very difficult to bring the world together to share information if there isn't subsequent sharing of the benefits of that information and in real time. And really that means access to all the tools, treatments, vaccines, diagnostic tests, PPE, oxygen, all of the basic things that we need in order to bring this pandemic to an end and also make sure we're better prepared for the future. So, but a comment on the panel reviews that have been taken, and you've mentioned the ones that I've been involved in, but also pay tribute to many of the others that have been drafted, written, and have taken up a lot of time, all of which are very good, many of which go back many years. And in truth, although there may be some that try to find the differences between these reports, whether it is the high-level panel for the G20 Italian presidency or the European Commission one, or indeed Barbara Stocking and others' reports after Ebola, or even going back before that, the similarities are much bigger than the differences. And what we mustn't do is use apparent, fairly trivial differences to delay or defer or prevent us taking action, because the similarities are very, very broad and very strong. And I worry sometimes that we create confusion by focusing on the differences rather than focusing on the similarities when the reports are all very similar and say very similar things. But if I could highlight a couple of things from it, sustained financing and the governance that goes with that is absolutely crucial. And there is broad agreement, as President Michel said, on the need for greater financing. The high-level panel recommended a global threats fund with a minimum, a conservative estimate of $10 billion per year through a fifth at the World Bank. Now, you can argue about the mechanisms here, but nobody argues about the need for it, or the need that this must go beyond traditional ODA and existing commitments, and it must not divert money from other critically important things that the World Health Organization does and other partners in the ACT-A consortium did, the Global Fund, Gavi, and others. And the second thing I'd pull out is the sustained, and the sustained is, I think, the most important word here, in surveillance, research and development and manufacturing, and that the center of gravity for that becomes global rather than just focused in a small number of countries. On the surveillance side, applaud the setting up of the WHO Berlin hub, now led by Chikwe, that I was privileged to be at the launch of in Berlin a few weeks ago, and we must all get round and support that. And I hope that Berlin hub becomes the first of a series of hubs at a global level. The surveillance has to be, though, linked into their ability to respond to it. The truth is, by the end of January 2020, the world knew really what we were facing with this. It wasn't necessarily just the surveillance that we needed to improve on. It was the ability to act when we identified worrying features. And so you cannot just have surveillance on its own. And that surveillance, in my view at least, must focus on bringing utility to public health systems around the world all of the time. Do not create, in my view at least, another vertical structure that only exists to look after a single issue. If we don't build this into resilient and universal health coverage around the world and strong and resilient public health systems, and integrate the surveillance into other issues which are important for clinicians and public health people, societies and communities, then it will not be sustained. Whatever the warm words at the moment about sustaining epidemic response, it will only be truly sustained if it's built into existing public health and clinical systems around the world and links with the animal sector. And then finally, on the research and development, so critical to have the tools available to us. And the manufacturing hubs. We can no longer just have manufacturing going on in a group of large population, mostly rich countries around the world, because we will always face in a pandemic situation this tension between providing for our domestic resources and tensions and our international responsibilities and commitments. And I personally would like to see a much more distributed manufacturing capacity. I think there is an opportunity to build on what I call small population countries that could produce for their own domestic demands very quickly and be exporting to their regions and the world very quickly. And if we leave it all manufacturing in big population countries, I'm afraid we will always have this tension of what they provide for their own citizens and what they provide for the world. And then finally, on the G20, G7 processes, these must become inclusive. And I would like to see both of them linking up much more strongly with the G77 initiative and global countries that will bring the world together. And then finally, I think what we are seeing in COVID is bringing into stark relief this tension between where domestic politics pull you in one direction, but your international responsibilities and indeed, as Dr. Tedros said, your international self-interest pulls you in a different direction. These will be the sorts of challenges of the 21st century. And I think COVID is highlighting how we are in tension between domestic and international, and we must try and bridge that if we're going to address the great challenges of the 21st century, of which COVID, I think, is the first, but will not certainly be the last.
Thank you very much, Jeremy. I think that that was very clear, and I think we have another clear ask here. I think we had okay, we were about to turn to our colleague, Dr. Happy, who is leading the African Center of Excellence, and to continue and give us some practical examples around surveillance, but we've lost the connection for the moment. So this is why I'm going to turn, if there are no immediate reactions from the speakers, maybe President Michel, do you have any immediate reaction to Jeremy?
Maybe an important point, it was also mentioned by Dr. Tedros. I think it's very important on Africa, not only to think about the short term, it's very important in the mid-term, in the longer term, to make sure that it will be possible also in Africa to increase the manufacturing capacities in the pharmaceutical sector. And here we can be very concrete and very operational. And that's exactly what we're trying to do with some African leaders, especially in Rwanda, in Senegal, also with Kenya, with South Africa, and the European Union. A few months ago, we decided together with the European Union that we would mobilize financing in order to make sure that it will be possible in those countries to develop very concrete projects with the support of the pharmaceutical sector and also with the public leadership, which is very important. In only a few months, we made a lot of progress, and it makes me optimistic because I have the impression that if we are totally determined, and it's the case at the European level, if we cooperate, it can be a very good example of a situation where we are learning the lessons and being very concrete and very operational. This is not an answer in the very short term, but for the mid-term, for the longer term, this is paramount in my opinion.
Thank you. Yeah, I think an important impulse for Team Europe that's already launching these kind of ideas. And I'm very glad to have Dr. Happy now back on the screen. So that's fantastic, and looking forward to you explaining to us the important work that you are doing around surveillance, as Jeremy was just making reference to. So if you could give us a short overview over your project, that would be extremely interesting to us.
Well, thank you very much, and then thank you for being here. And it's a real privilege to be on the same stage with Dr. Tedros, Jeremy, and Michel from the European Union. What we're basically doing is that we set up a system called Sentinel, and this was before the COVID pandemic, and it was basically to preempt and respond to future, pandemic. And it is a system that is built on three major pillars. The first pillar is detect. That is detecting as early as possible known and unknown pathogens. Because we are where we are today simply because we did not have the ability early enough to detect this virus. Now we have the technology, we have the skills, and then we are able to, we've set up a platform and a framework to detect known and unknown viruses early enough, and share this information with public health authorities, be it at district level, national level, regional level, and also global level. And in addition to connecting this information, we also set up a framework to empower frontline healthcare workers and then the public health communities in order to be to improve our ability to preempt and to respond to pandemics. Now, let me just break it down in detail and then kind of show you how we've been able to activate this system during this pandemic. Although it was funded by some philanthropists before the pandemic, we demonstrated that the system worked very well. First of all, is the fact that when the first cases of COVID, for instance, arrived in Nigeria, in collaboration with the National Nigeria Center for Disease Control, we were able to reveal the genetic makeup of the virus, that is, sequence the virus in an unprecedented speed, 48 hours. So we knew exactly what the structure of the virus was, where it came from, and the Nigerian government was able to take this and start making action with it. Within this time frame, we've been able to, just a small center like us, test 148,000 samples in Nigeria. In addition to that, we've been able to use this technology, the CRISPR-based technology, to develop a rapid diagnostic test. That is the first nucleic acid-based, diagnostic test. That is like you're doing PCR on a sheet of paper. And this test can be deployed in the most remote places in the world. And it is done at room temperature. You need no equipment to do this. And this can be done for COVID, but we've also tested this for many other viruses and pathogens. In addition to this, we've been able to combine, that is, you do multiple tests on multiple samples. That is doing 168 viruses in one single test. And that is very useful for surveillance moving forward. And we're working this in collaboration, not only with the national public health system, but also with the Africa CDC, with whom we explained that bought into this system way early. Now, we also are building capacity on the ground and in the continent. This program that was piloted initially to Nigeria and then 4 other West African countries became very useful for the continent because within this pandemic, we have been able to train 15 different African countries to generate their genome sequence data for surveillance purpose. We've also supported those countries to generate genomic sequence data for public health response. One case, for instance, that I could mention here is how we work together with the Rwanda Biomedical Center to identify the Delta variant in Rwanda at the point in August of this year. And with those information, we made them actionable, and Rwanda was able to shut down, go into a lockdown and help the country to actually, contain the third wave. So, and in doing this, we are building the critical mass that is needed, not only for Africa, but also for the world. So we are building a system piloting a system in West Africa that is very flexible, and also a system that can be, it's agile and that can be adopted, expanded or deployed in other places in Africa, but can be adapted anywhere else in the world where we really need to use such a system for pandemic preemption. But we are not doing this in isolation. We're embedding this into the local, national, continental public health system. We're working with WHO Afro in a very close collaboration. We give them updates regularly. So we basically just working a framework that can be used and replicated in the world so that we can actually start having a platform that can enable us preempt, the future pandemic. But what is most important is one thing that we just did recently, and I was demonstrating this in Nigeria. We set up a platform. We all know that there are a lot of, platforms out there that can capture all kinds of information. But what we've done is actually to set up a platform where citizens can add in their data, information about their health status, where information can be collected in clinics, in remote villages, and generally in the public health system. And behind we have a cloud system that can analyze and make all this analysis and make this information actionable for a public health official, a minister or a governor or anybody at WHO. You can have a dashboard where you can see in real time what is happening anywhere in your community or anywhere else in the world. These are the kind of things that we think, moving forward, we can all have and develop this kind of thing in cooperation with other platforms and other groups and with the global public health and international community in order to really set up this, to expand this platform called Sentinel, which is an early warning system for pandemic prevention and response.
Thank you very much, Dr. Happy. And I think that's been an excellent example, how many of the policy recommendations that we were calling out in this panel and integrating it into a global health system and health services, a very effective surveillance system, coordination regionally, skills transfer across other countries. I think that's, we're seeing this live, how this is happening already. I do have a couple of questions from the audience, but before that, any reactions to Dr. Happy's Sentinel presentation? Jeremy, I don't know if there's anything you want to add to that.
No, as Christian knows, I'm a huge fan of his and his team and his link into Nigeria CDC and the African CDC. It's a model for all of us. Nothing to add other than just huge credit.
Yeah, I think that. Dr. Tedros?
No. First of all, thank you, Christian, and congratulations. And we're really proud of what you're doing. And then the second, what he said is very, very important. Early detection is key. And as what he had said, with early warning system, we can manage outbreaks, epidemics or pandemics more effectively. And as you may know, the Berlin hub we just launched recently is established with the same concept, global level, but it's an early warning system. But that early warning system will not be effective without strong surveillance system at country level, which Christian is building. So the Berlin hub is established on the concept that there will be collaborative intelligence, meaning bringing all together the academic institutions, government institutions, NGOs, private sector, everybody. So collaborative intelligence to detect things as early as possible. And with the idea of, as he had said, a dashboard. So in real time, you see what's happening where. And if you can detect it early, you can respond quickly. Of course, before early detection also comes prevention. And whatever studies we do in diagnosis can help us also to understand what could come and be able to prevent it as well. So thank you so much again, and I hope, as Jeremy also said earlier, not just one hub, we will have more hubs, and all institutions can be networked so the collaborative intelligence is properly implemented. Thank you. Back to you.
Thank you very much. Thank you. I'll turn to some of the questions we received from the audience, and the first one is probably one for Dr. Christian Happy or, again, Dr. Tedros. It's a question from Anja LANGENBUCHER. The question is, how can the civil society sector from developing nations be a part of better pandemic preparedness? How do we make sure that they're being heard? Dr. Happy, would you like to take that, or Dr. Tedros?
Yeah, I can just make something before Tedros. I'm sure he has a global view. But I can really just speak from this end by saying that, for some of the systems that we are developing, we are involving citizens. So it's really not necessarily, the business of the Ministry of Health alone or the government alone. We are setting up apps that involve citizens, where citizens can put in information that they're getting. I mean, where citizens can provide information, and that becomes very important, where you are engaging people, using technology to engage people so that they can actually provide information. Because, look, there is no better detective in the world than the individuals and the people. And that's what we call our platform Sentinel, whereby we believe that everybody in the world should be a sentinel, and the sentinel of the globe. And we believe that, by engaging people, then the civil society will find itself highly engaged, and that really what we think that will make a difference.
Thank you. Dr. Tedros or President Michel?
Yeah, and we can see that also the young generation is participating, which is very, very, very good. And I say hello to the young generation. But more seriously, I think there's another important field for the civil society. This is what we call One Health. We have understood better and better that there are many links between the health of our environment, the health of the well-being, but also the animals' health. And I think that we need to be more focused on this priority, and I'm convinced that the experience, the expertise of civil society to be very useful in this field.
Yeah, I agree. Thank you very much. Nothing more to add. There's another question that is maybe one for Jeremy. What is the role of philanthropic organizations in health system strengthening?
I'll give you a view from a philanthropic organization, and it'd be interesting to hear your view as well. But philanthropy can't do everything. I think where philanthropy can play its biggest role is in catalyzing things, in taking risk, in setting up things which it might be able to do quicker than understandably governments or regional organizations, the European Commission might be able to do for very, very good reasons. And so I think philanthropy can be catalytic in that way. But philanthropy will achieve its greatest impact when it combines and partners with national governments, with civic society, as you've mentioned just now, with the World Health Organization and other agencies, because none of us can do this on our own. That's where I think philanthropy can play its best role in partnership with working with others.
Yeah, and I would very much agree with that. I think catalytic action and the ability to convene and bring data and evidence to what could work and expertise is probably that where philanthropic organizations can be helpful, but really it is about governments that need to then implement and take on the political momentum that we were talking about. I have another question, which is probably to the entire panel again, maybe Dr. Tedros or Jeremy. How can universal health coverage contribute to future pandemic preparedness? We touched upon that already a little bit in all the answers, but maybe something specific you want to call out on that UHC debate.
Would you like to start, or you want me to start, Jeremy?
You go, Tedros.
You start.
No, thank you. That's a very central question, actually, very important. if there is anything that this pandemic has shown us, is the centrality of health. We have been saying, WHO and many partners, Jeremy and others, all roads should lead to universal health coverage. This is even before the pandemic. And we have been advocating for health for all. The reason for that is, if you have universal health coverage or health for all, it means you're giving access to all citizens, and no one is left behind. When you do that through universal health coverage, you can prevent, outbreaks. You can detect them early, and if it happens, you can provide also the services, the support you need, or you can manage it well. So the strengths of the health system or your coverage, universal health coverage, can be make it or break it when you respond to outbreaks, epidemics, or pandemics. So I hope with this pandemic, the whole world has understood the centrality of health. I hope. And I hope that, countries, because of that understanding, the centrality of health, will move to make significant progress, to honestly believe in universal health coverage, to honestly believe in health for all. And we have been asking for one thing in order to make it happen, if they really truly believe. We ask countries, there are some countries who have in their constitution that identify health as a fundamental human right. So we ask each and every country on earth to identify health as a fundamental human right in their constitution, and that will be the basis actually to build universal health coverage or to achieve universal health coverage or health for all. So I'm just using your question to make that one ask. A fundamental human right, health as a fundamental human right in each and every constitution of the countries on earth. That collectively will bring better capacity globally, because there is better national capacity. It's when at national level you have good coverage and good system that the collective capacity also becomes stronger. Thank you.
Okay. Jeremy, do you want to add anything to this?
No, other than to agree. But I think one thing that's crucial is that all epidemics, happen in the context of everything else happening in the health system and indeed across the whole of society. They don't happen in isolation. They start in communities and they end with communities. And the critical element of universal health coverage that I think Dr. Tedros is talking about there is also about trust. It's about trust of a community and a society that the system will be there when they need it, both in good times and bad times. And without universal health coverage, without the trust that comes from that between the governed and the governing, then I don't think we can address all of the health challenges, but then have the resilience and surge capacity to deal when epidemics do inevitably occur. And the universal health coverage and the human rights that Tedros talks about there, that's the real demonstration of political commitment. Not warm words, but actually delivering that.
Thank you very much. I think this is a good point. We've come already to the end of our panel. Thank you very much, Excellencies, that I was able to moderate this panel. I mean, I think we've touched on a lot of really important things. I think with the numbers that you started with, that 80% of countries will not achieve the 40% coverage that we set ourselves as a goal by the end of this year is very drastic. And I think this is, the wake-up call that we all need to bear in mind. I think thinking about an actionable treaty that has teeth, so to say, in order to really call responsibility and accountability to the signatories, I think would certainly be a great step forward. And thank you very much much to Jeremy and Dr. Happy for calling on, surveillance and some of these really important examples on how to build that into the health system and to make sure that we are next time around better prepared. So I think we've touched upon a lot of important things. Let's hope that, the upcoming opportunities of the World Health Assembly can take up some of these. Thank you. Thank you very much. Parting thought now?
I just wanted to use the opportunity to thank President Michel, Charlie Michel. He's the one who proposed the treaty idea. And we ask people actually to give us crazy ideas. It's one of the crazy ideas he proposed without even asking him. So I would like to use this opportunity to thank him for proposing that idea. And I hope it will happen. Of course, it needs time and patience and compromise. But I hope whether it's treaty or agreement, a binding instrument, I think if it's binding, as long as it's binding, it could be a treaty or agreement or instrument. But I hope we will have it. But thank you so much, Mr. President. Merci beaucoup.
Thank you very much. Merci. Thank you very much.